Hi everyone, I'm clinical nutritionist Madhya from Healing Hands Clinic and I welcome you all. Today is 17th May and 17th May is often celebrated as World Hypertension Day. So today I shall be discussing 5 ways to improve heart health and to control blood pressure. First, include good fats in your diet. I've always been recommending ghee to all my patients. Today, even if you read up international journals, even at the international level, people have approved of Indian clarified butter in improving heart health and helping to control blood pressure levels. So you can always include ghee as part of your curries, on your rotis, on rice, in vegetables. So for males, it is recommended to use up to 2 tablespoons of ghee on a regular basis, and for females, up to 1 tablespoon. Besides ghee, there are other good sources of fats. For example, peanuts, cashew nuts, almonds, walnuts, and pistachios. We often hear people saying that cashew nuts are high in cholesterol, peanuts are not good for heart health. But did you know that plant sources are devoid of cholesterol? They naturally do not contain any cholesterol. So if you are someone who's suffering from high blood pressure or any heart-related ailments, make sure you're including these nuts and oilseeds in your diet on a regular basis. So one of the main oilseeds that you have to include is flax seeds, because flax seeds are very good sources of ALA, which is good for heart health. So flax seeds can be used in chutneys, they can be used as part of your curries, they can be pounded and sprinkled over your salads and soups. The second thing that you need to include is, need to understand is that air fried foods are not healthier than deep fried foods. For example, if you take samosas, most of the patients nowadays prefer air fried samosas, air fried bhajiyas, everything that is air fried. But this doesn't bring a sense of satisfaction. Your brain doesn't send the signal, you don't feel satiated. So you land up eating more than your body needs. So I would recommend my patients to eat foods that are naturally prepared using natural traditional methods of cooking. So if you serve a deep fried samosas, do not hesitate, eat it. The third thing that you need to understand is that if you drink alcohol either occasionally or on a regular basis, thinking it is good for your heart health, so that's a myth. So we come across patients on a regular basis who say wine contains polyphenols, which is good for heart health. But you need to understand that these polyphenols, which is found in wine, is also found in a lot of fruits and vegetables. So make sure you include 2 servings of fruits, 4 to 5 servings on vegetables on a regular basis to get your RDA, your recommended dietary allowance for the polyphenols throughout the day. The fourth thing that you need to do is exercise. Often we misunderstand exercise as walking. So if you tell someone to exercise, they'd be like, okay, fine, we've walked 5,000 steps, 10,000 steps, we have walked for an hour, for 2 hours, we do walking on a regular basis. But exercising and walking are 2 different things, okay? So when I ask you to exercise, I mean strength training. So you have to strength train at least once or twice in a week, either at home or at the gym. So your heart is a muscle, it needs to be strong. So to make it strong, you don't have to just walk, you also have to strength train. But unfortunately, there are many people who start to exercise after they have suffered from the first heart attack or after they have been implanted with a stent inside their valves. So don't wait for the first heart attack, start exercising so that you can prevent it. And the next point that you need to understand to control high blood pressure is you don't need to cut down on salt intake. So around 3 to 5 grams of salt, that is 1 teaspoon of salt on a regular basis, is what your body needs. Just avoid table salt and avoid the fancy salts like some months ago there was Lona. There was a salt that came in the market by the name of Lona, that means low sodium. But if it's low on sodium, it's definitely high on some other nutrient. For example, that salt was high in potassium. So if you go overboard on potassium, thinking it's good for controlling high blood pressure, you may suffer from arrhythmias, from tachycardia, from bradycardia. Basically, your heart rates can start fluctuating if you consume too much of potassium. So don't go for these fancy salts. So many patients ask me, what's the difference between a mineral salt, between a black salt, between a pink salt and a rock salt, and different salts. All salts are salts at the end of the day. You have to take it under limit. Just avoid table salts. And so many patients cut down on their salt intake, but in the evenings with their chai, they will eat a lot of biscuits, curries, chips, farsans. These are high in salt that your body doesn't need. So that is what you have to cut down, not your regular salt that you use for cooking. This was all from me. If you liked it, do share with your family and friends. If you still have any questions for us, you can write to us in the comment section below. I'll see you next time with something more interesting. Till then, take care. Bye-bye.